Hello and welcome to the video on bone. So first we're going to talk about some functions of bone and how it does it. So first one is shape. Bones give the body its structure. If you didn't have bones, you would be basically a puddle on the floor. Next is support. So the bones of the legs, pelvis, and vertebral column support the body and hold it upright. The next is protection. Bones protect our delicate internal organs, like your ribs protect your heart and lungs, your skull protects your brain, and your vertebrae protect your spinal cord. And then movement by themselves, muscles can't do anything unless they have something to pull on. So they pull on our bones, and that allows us to move. Electrolyte balance, so bones store and release minerals, mainly calcium and phosphorus. Blood production, so bone marrow is found in bones, and that is where we form all of our new blood cells. And then finally, acid-base balance, so bone absorbs and releases alkaline salts to help maintain a stable pH. Then we need to know next the parts of a long bone. So if you took a bone, this is actually a tibia, and sawed it in half, you would see the inside. So the end of a long bone is called the epiphysis. The end of a long bone here is the epiphysis. Then this long tubular part is the diaphysis. The articular cartilage is found on the ends of the bones on each end, and we'll talk about bone formation in a little bit, but bone starts out as cartilage, and there's a little bit of cartilage left over at the end, and that allows a smooth surface where it meets with another bone. The medullary cavity is here in the middle. The endosteum is a thin membrane on the inside of the bone lining the medullary cavity. Red bone marrow would be found here in the epiphysis, and that's where new blood cells are formed. Then yellow bone marrow would be found here in the medullary cavity, and it is basically just fat. Then the periosteum is this tough fibrous covering on the outside of the bone, and it protects the bone. It's also what tendons anchor into. And then the next thing we're supposed to know is the epiphyseal plate. So this is a fully grown bone, and the epiphyseal plate has turned to bone, but if you looked at a child's bone, there would be a layer of cartilage here. And this is where bones grow in length. So I mentioned bones start out as cartilage, and then as they're formed, there's a layer of cartilage at the end. There's also a layer of cartilage here at the epiphyseal plate, and that allows the bones to grow in length. Alright, now we have a question about functions of bone. And you're supposed to pick all that apply. And the correct answer is A, B, and C. So electrolyte balance, blood production, and acid-base balance. Regulation of blood glucose, that is the job of the endocrine system. Alright, some cells we need to know. So osteoblasts help form bone. So blasts build, that's how I remember that. Osteoclasts are going to dissolve unwanted bone. Osteoclasts cut with a C. That's how I keep those two straight. Then osteocytes are the mature osteoblasts, so as bone is formed, osteoblasts become osteocytes, and they help maintain the bone. Collagen fibers make our bone highly resistant to stretching forces. This is called tensile strength, so these are proteins. And then the calcium salts, it's mainly calcium phosphate. These allow bones to resist strong squeezing forces, so this is called compressional strength. Calcium salts make bones very hard, give them their rigidity. So next thing is is the effects of an increase in load. And when bone experiences an increase in load, the osteocytes sense that and stimulate the creation of more bone. So this figure here is from a study they did on tennis players, and they did, I believe, MRIs of their arms. So if you're a tennis player, your serving arm gets a lot more use than your non-serving arm, and you can see the darker brown layer is the added bone matrix, because that serving arm takes a lot more stress than the non-serving arm. So you can see it was a lot thicker. And if you look at like a bodybuilder's bones, they're much bigger than, for instance, a couch potato's bones. In the movie Wall-E, you can see what happens to people's bones when they just sit in a chair all day. They kind of shriveled up to nothing. Alright, next thing is spongy bone. So it looks sort of like a sponge, although it doesn't feel soft like a sponge. It's found in the ends of the long bones and in the middle of other bones. Within the spongy bone, you can find red bone marrow, which is making blood cells. Then compact bone forms the shaft of the long bones and the surfaces of the other bones. So this part of bone is really strong. Spongy bone is also strong, but not as strong. But spongy bone is more lightweight. Compact bone is solid, very strong. And the basic structural unit of bone is the osteon. Alright, there's two types of bone formation. Ossification is bone formation. Intramembranous ossification is ossification of fibrous connective tissue. So in the fetus, the developing baby, it starts out as just a layer of connective tissue, and then it's slowly turned into bone. This is how our flat bones like the skull and face are formed. Then we need to know why a newborn has fontanelles. So this picture shows a fetal skull, and you can see like the anterior fontanelle and the posterior fontanelle. Those are commonly called soft spots. They allow the baby to pass through the birth canal easier. That's why babies come out with a cone head. They also allow the skull to expand as the brain grows rapidly. In your first couple years, your brain grows really rapidly, and they are completely ossified by the age of 2. Now, endochondral ossification is the ossification of cartilage, and this is how long bones are formed. Most of our bones are long bones. And this shows the steps here. So we start with a cartilage model, and then bone formation starts on the outside. We form what's called a bone collar. Then blood vessels will grow into this and form what's called a primary ossification center in the middle, and slowly it will start to form bone, replacing the cartilage. And then more blood vessels grow in, and the bone is remodeled. And then the very last step would be the ossification of the ends of the bones. Alright, next thing is how bones grow in length, or how growth hormone causes bones to grow in length. So if you look at that epiphyseal plate, or growth plate it's sometimes called, this is what it would look like. And there's different zones. Again, this is cartilage. You see the zone of proliferation there. That's where cells are dividing. And growth hormone is going to signal those cells to divide more rapidly. And as those cells divide and grow, they kind of push out on the ends of the bone, and this is happening on each side of the bone, so the bone grows in length. So bone lengthening occurs at the epiphyseal plate for a fixed period, basically till the end of puberty, but bone widening continues throughout the lifespan. So we're going to watch this.
After about 3 months gestation, A fetus has a skeleton composed mostly of cartilage. At that time, the cartilage begins to turn into bone. This process, which begins in long bones, is called endochondral ossification. The process begins as osteoblasts start to replace the cartilage cells, called chondrocytes. The osteoblasts coat the diaphysis in a thin layer of bone, after which they produce a ring of bone that encircles the diaphysis. Soon the cartilage begins to calcify. Blood vessels then penetrate the cartilage, and a primary ossification center develops in the middle of the diaphysis. The bone marrow cavity fills with blood and stem cells. Ossification continues, proceeding from the diaphysis toward each epiphysis, and the bone grows in length. Eventually, secondary ossification centers appear in the epiphyses. Bone lengthening does not stop at birth. Bones grow in length for a fixed period. As shown by the end of this long bone, lengthening occurs at the epiphyseal plate, a layer of hyaline cartilage at each end of the bone. On the epiphyseal side of the cartilage plate, chondrocytes continue to multiply. As chondrocytes move toward the diaphysis, minerals are deposited and the cartilage becomes calcified. As long as chondrocytes are produced in the epiphyseal plate, the bone continues to elongate. Sometime between the ages of 16 and 25, all of the cartilage of the epiphyseal plate is replaced with spongy bone. When that occurs, bone lengthening stops, and the epiphyses are said to have closed. What remains is a line of spongy bone called the epiphyseal line.
Alright, so next thing is bone remodeling. So bone cells are working constantly throughout your life, destroying old bone, called resorption, and that's the osteoclasts that are doing that, and depositing new bone, or ossification, and that's the osteoblasts that are doing that. In this process, osteoclasts remove matrix and reduce the mass of little-used bones. In heavily used bones, osteoblasts deposit new bone tissue on the bone surface, thickening the bone. Remodeling repairs minor traumas and contributes to homeostasis by releasing calcium into the blood. Then osteoporosis literally means porous bones. It's a condition where bone remodeling gets out of control and there's more resorption or breaking down bone than there is building new bone. And the bones lose so much mass they become extremely brittle, and something like a cough could cause a fracture. On the right you can see normal bone matrix and then osteoporosis bone matrix. So you can see the normal bone matrix is much thicker. Next is 4 factors that affect bone growth and maintenance. So one is heredity. People in tall families tend to be tall. One is nutrition. If you don't get enough nutrition, you can't grow. The other is hormones. You need to have growth hormone as well as other hormones to help you grow. And those hormones are only released if you have proper nutrition. And the other one is exercise. We looked earlier at how if you increase the stress on a bone, it grows in response to that. So those all affect bone growth and maintenance. Alright, next thing is fractures. So in the left picture you can see a simple fracture. The bones stay aligned, the surrounding tissue is intact. On the right you can see a compound fracture. It's one where the bone ends are not lined up and the bone pierces the skin. Much greater risk for infection because the skin is broken, so compound fractures are much worse. A green stick fracture is what you see there on the left. It's an incomplete fracture. Usually occurs in young children because their bones are softer and more flexible. And then on the right you can see a comminuted fracture where the bone just kind of is crushed and breaks into pieces, such as might happen after a car accident. Those are much worse. And then a spiral fracture is when the fracture line spirals around the bone. usually from a twisting force. Um, these are harder to fix as well. Then the last thing is fracture repair. So let's watch this animation.
When a break in a bone, called a fracture, occurs, blood vessels in the bone and periosteum are torn. This results in bleeding and the formation of a hematoma. The hematoma soon transforms into a soft mass of granulation tissue that contains inflammatory cells and bone-forming cells that aid in the healing process. Collagen and fibrocartilage are deposited in the granulation tissue, transforming it into a soft callus. Next, bone-forming cells produce a bony or hard callus around the fracture. This splints the two bone ends together as healing continues. Remodeling eventually replaces the callus tissue with bone. Uncomplicated fractures heal in 8 to 12 weeks. Complex fractures, and fractures that occur in bones with a poor blood supply, such as the neck of the femur, take longer.
Okay, so here's the steps of fracture repair. First, there's a lot of bleeding and a hematoma. Basically, a big blood clot forms and it's transformed into granulation tissue. That granulation tissue then transforms into what's called a soft callus with more fibers. And then a hard callus forms around the fracture. And then bone remodeling will replace the callus tissue with bone, and after a while, you can't even tell it was broken.